Hey everybody, welcome to another episode of Ask Dr. J. And one of the questions that I get quite a bit is, when is it appropriate to take out all your teeth and do all on X, all on 4, what we call one-shot smile here, basically a full implant rehabilitation? Or when is it appropriate to keep some teeth and maybe do some single implant replacement with a couple missing teeth here or there? And the truth of the matter is there's not really a one-size-fits-all for this question. It really depends on how many missing teeth do you have. How are the teeth lost? What's the current condition of the teeth that are there? Are they decayed? Are they broken? What is your bite like? What is the condition of the supporting bone structure? So all these factors come into play to basically make the best decision of, are you going to do a full mouth implant rehabilitation, or maybe do some crown, some veneers, some ortho, and a couple implants so that you can get the best treatment. So again, it's not a one size fits all, and we're going to go into why each of these can be a good option. So first, let's go ahead and talk about the full mouth implant rehabilitation, all on 4, all on X, and why that is maybe a good option. So you got to look at how many missing teeth do you have. So the all on 4, all on X procedure it's a much better value for what you're going to do. On top of that, in these situations, the position of the teeth and what they look like, if you really want to get a ideal smile and function, it's like a blank slate. You can start clean and get a whole new set of teeth that's going to last the longest. It's going to function well, and again, it's going to look the best. You're going to get the most aesthetically pleasing smile. And I'm going to go ahead and give you an example of a time when I had a patient who basically didn't go with the all on 4, all on X option or the full mouth rehabilitation, and it really didn't go well in the sense that the patient had to continually be in my chair and get treatment. So this patient was a doctor, and he had full mouth rehabilitation. He had teeth that were worn and they had cavities, and so he had crowns put on every tooth in his mouth to basically correct his bite and fix the teeth at the same time. However, because the underlying tooth structure wasn't phenomenal, 3-4 years after the rehabilitation, he broke a tooth off. And this is where I saw him. We did an implant, and he broke another tooth off, and we did another implant. So as he's doing this, he's having to come back for more visits. There's more cost associated with it. And at one point I said, Doc, why don't we go ahead and do this full procedure so that we can transition you gracefully into a new set of teeth, give you something that's going to look good, feel good, work good, and it's going to last a long time. And I think for him, there was maybe a fear that losing teeth is maybe part of aging. And I can even speak to that myself. I just lost 2 teeth myself, and it really kind of hit me. Now, for me, I'm not a candidate for the all on X procedures, and I'm going to be getting 2 single implants because my remaining teeth are okay. But for him, it would have been a much better treatment to, again, transition him into a full arch implant, because he ended up getting 11 single implants. Now, for him, again, this gentleman has passed away. Money was not an issue, but you can imagine if you're trying to get the most value and get the best smile and do it in a way that you're not sitting in the dental chair seeing me all the time, getting 11 implants, there's a better way to do it. So this is, again, an example of where keeping teeth really wasn't the best option. And if you're in that situation, it's really important that you get multiple consultations to see what is the right treatment for you at that time and what's going to work best. So on the other hand, when might it be a good decision to keep some teeth and replace a couple teeth with implants, kind of like in my situation? So maybe you have all good front teeth and they're a little bit misaligned and you're missing some back teeth. So very often that's going to be a better option to replace the back teeth. Sometimes you may need some bone grafting to do this, and maybe do some aligner therapy to straighten the front teeth and get a beautiful smile there. Or maybe you're missing 1 tooth in the front and the rest of the teeth are healthy enough to put veneers on them. Or another situation is you've got worn teeth from grinding or a bite problem, and you need to have that restored or rehabilitated, and maybe you need to do what's called onlays or ceramic crowns to rebuild the bite properly so you can chew, and maybe some veneers in the front with an implant. So there's lots of scenarios. If the remaining teeth are still healthy, you're missing 1 or 2 teeth, you can replace with implants, maybe do some aligners, maybe some crowns or veneers, and that's what we call really full mouth rehabilitation. We're incorporating all the disciplines to really give you, again, the best plan for you at that time. And I've had patients come to me multiple times, one just last week, where they came in asking for an all on X procedure that they had seen on a commercial, and they just were not a candidate. So I had to tell them that I am not willing to do this for you because their teeth were in great shape. They needed a little bit of aligner therapy and a couple implants, and they're asking me to take all their teeth out. out. So again, it's a phenomenal service to be able to recreate your smile all at one time, but you have to be the right candidate. And it's also important that if you're holding on to teeth for the sake of just trying to keep some in place and you want to rehabilitate your smile and your function, that you go with the right direction and do one of these full arch implant rehabilitations. It's important that you get a consultation, that you get a second opinion even when you come see us. So it's really important, again, to look at this thoroughly so you can get the best treatment for you at that time. So I know I just gave you a lot of information, and here's something to think about. If you happen to end up at one of the large implant chains that are in major cities, there's many of them here in DMV, that's what they do. They do implant treatment, whether it be full arch or tooth replacement, but you're not going to get any other options there. That's what they do. If you go to local restorative dentist that doesn't place implants, you're probably going to get a treatment plan for restoring all the teeth, maybe using a bridge for missing tooth, maybe using buildups and root canals, and that type of treatment plan that might not be the best either. So really what it comes down to is here at Dental Masters, we do really both. We do all on X. It's something that we focus on very, very much here, restoring people's mouth with full arch implant. It's something I'm very passionate about, and we do it all the time. But we also do full mouth rehabilitation where we're doing aligners, veneers, and single implants. So it comes down to, again, really partnering with your dental professional and coming up with what's the best treatment plan for you. To sum it all up, I'm always going to have your best interest at heart. And it's really, really important, if you're making a decision of this magnitude, to make sure that you do your due diligence and find a dental professional that's going to look at your entire situation so that you can get the best treatment plan to restore your smile, your function, and your long-term oral health. As always, thank you for tuning in to another episode of Ask Dr. J.